All right, Jenna. After reviewing all of the documentation that I took from taking your probing depths and everything like that, I determined that your smoking is a huge factor in your advanced periodontal disease.
Oh God.
So the first couple things I want to talk with you about is you had mentioned to me how do you have gingivitis and advanced periodontal disease when your gums don't bleed. Well, the reason that your gums don't bleed, Jenna, is because your smoking actually masks your symptoms of periodontal disease.
Oh.
And what I mean by that is your blood vessels, when you smoke, it heats up your blood vessels and it makes them constrict, so your mouth doesn't bleed when you smoke.
That sounds like a serious problem.
It is a serious problem, Jenna. So I'm going to discuss with you a couple things that we can do to change this. First and foremost, my recommendation would be to stop smoking, or at least cut down. You had mentioned that you smoke about a pack a day, and you know that's a lot.
Maybe.
So
I'll try. I'll try.
All right. And another thing I wanted to mention. When you smoke, you're more prone to calculus and pocket depths. There's periopathogens in your plaque. You have a lot more of them when you smoke. So you're more prone to calculus, you're more prone to staining, and you don't want that. Also, Jenna, you're at a higher risk for oral cancer when you smoke. I did an oral cancer screening on you earlier when I was examining you, and as of right now, you do not have oral cancer, but
I thought you scared me. I thought maybe,
Yeah, it certainly could develop into that though, so, it's very serious. And as far as your pocket depths go, you're measuring in at about a 6 or 7 millimeter pocket depth, when really you want it to be between 1 and 3. So I'm going to go through the slide with you, and I'm going to discuss some of these things and show you pictures of the pocket depths that I was talking about, and then we're going to go over how to properly brush and floss. All right?
All right, that's good because I'm getting a new job and I'm the front desk, and I'm going to be working with, like talking to people, and I've noticed the staining, and I've got bad breath, and we need to, fix that.
Okay. Are you experiencing dry mouth at all?
Yeah, a little bit.
So that's called xerostomia. That's another symptom of smoking. So, my recommendation again to you would really be to cut down, as much as possible, and try to stop if you can. Maybe talk to your doctor about remedies you could take to stop that. So,
okay.
All right? So, here we go. Do you like my dancing floss?
They're good. Those kind of look like cupcakes.
It's toothpaste. Okay, so this is the parts of a tooth. So remember earlier how we were talking about pockets?
Yes.
Well, this is basically like your sulcus, and this is your crown and enamel. This is the part that you and I can see clinically. When I'm putting the probe into your sulcus to measure how deep your pockets are, I'm putting it right here. And your bone levels are somewhere down here, because when you're smoking, you are losing bone. You're prone to bone loss. So your bone has retracted and pulled away from the tooth and has come down farther and farther, and like I said, you have 6 and 7 millimeter pockets.
God, is my tooth gonna fall out?
So now I'm gonna discuss with you how to properly brush your teeth.
So once a day you think is good enough, right? To brush?
Well, I recommend 2 to 3 times a day, and especially if you're smoking. So I would recommend that you brush your teeth after every time you smoke, especially if you don't want to harbor bacteria and you don't want to have that ashtray stench.
Oh, good, because I hate it.
Yeah. So.
But I love my cigarettes.
So I bet you do, Jenna. I bet you do. So the method that I'm going to recommend for you is the modified bass. And what the modified bass is is it's a brushing method where you hold your nylon toothbrush. You want to have a nylon toothbrush. That's what we recommend. It's the best one, you know, doesn't harbor bacteria. So you want to hold it at a 45-degree angle against facing towards your gum line, and you want to do 10 vibratory strokes, and you want to sweep away. And then you want to go to the next tooth, 10 vibratory strokes, sweep away. Would you like to try? Okay. So when you do it, you want to try not to be so abrasive on the gum line, because you're kind of like doing it on the gums, and that can actually cause receding gums. So you just want to do it, like I said, at a 45-degree angle. Kind of put the bristles a little bit under the sulcus, the gum line. 10 vibratory strokes. Sweep away.
Okay.
Try again.
I'll try again. Like this?
Yes. Oh, Jenna. Another recommendation that I have for you. This was the more cost-effective way, but especially because you smoke. I mean, I really recommend electric toothbrushes for anyone, but especially due to the fact that you smoke, I really recommend using an electric toothbrush. What you do with this, it actually does the vibratory strokes for you. So you just hold it in place at the gum line, like I said, sweep away. Hold it, sweep away. And I recommend this because it will be more effective in removing plaque and biofilm, and it could help with staining or anything like that. So I really recommend that. Another option I have for you is the Proxy brush. I'm recommending the Proxy brush for you because you are a smoker and you have very deep pockets and you have slightly open contacts. The fact that you have open contacts, you could actually, you know, fit this in between your teeth. So you just go like this to clean any bacteria in between those contacts.
So like, is that a substitute for flossing?
It's not a substitute for flossing. I would do this in addition to flossing.
Okay.
Okay? And we'll discuss later how to floss properly.
Seems very simple.
It is simple. Good. I'm glad. I'm very glad. That's what it's all about, making it simple for you. Okay. So now we're going to discuss how to properly floss. So you want to get an arm's length of floss. You want to put it on your middle fingers, and you want to put more of the floss, roll more of the floss on your dominant hand. I'm left-handed, so more of it went on my left hand. Okay, so when you floss, a lot of people, when they floss, go like this, up and down, up and down, up and down. Is that what you do, Jenna, when you floss, or do you not really floss?
I don't really floss.
Okay, well, people that floss, that's what they typically do. What you actually want to do is you want to make a C shape around the tooth, and you want to insert it like a seesaw, and you want to go back and forth slowly and come out. And then you want to change the part of the floss that you're using so you don't transfer plaque and bacteria to the next part of the tooth. Understand?
Mm-hmm.
So seesaw in, C shape around the tooth. Okay? Would you like to give it a try? Or do you need more instruction?
No, I think that's okay.
Okay. Here you go. I'll hold it for you.
Oh, perfect. Oh, wrong hand.
Wrong hand. So C shape. Okay.
What about my bad breath? You didn't mention that. What could I do for that?
What can you do for your bad breath? Well, my recommendation would be to use a mouth rinse in addition to brushing and flossing, and also a tongue scraper. Okay?
Okay.
All right. So this is healthy versus unhealthy enamel and tissue. So healthy gum tissue will look stippled, it will be pink, it won't be inflamed, it will adhere to the enamel.
It won't be red.
It won't be red.
Awful like mine.
No. So this is unhealthy gum tissue over here. Unhealthy is very red, inflamed. You know, you have some rolling of your gums going on. You have extreme periodontal pockets, and your gingiva is actually pulling away from your tooth enamel.
Oh.
So, we can recommend some Arrestin for you. It's a local antibiotic that can help. I've heard good things about it, and I've seen patients receive some great progress when using Arrestin. So that's also something that I recommend for you.
Okay.
All right. Okay. So these are the stages of gingivitis and periodontitis. Jenna, unfortunately, I would say that you are at about a stage 4, advanced periodontitis.
Oh.
So you have major loss of bone structure. It's evident in movement on many teeth. Crowns of teeth appear longer due to recession of gums, and teeth shift, making it difficult to eat. So that's what you have. Another thing that I recommend for you, when we were doing, when I was taking your medical history, you had told me that you eat a lot of sugar, you really like candy.
I love my Diet Cokes.
Okay.
Love them.
Okay, so unfortunately, plaque and calculus and biofilm love sugar. So they're all going to want to adhere to your teeth when you're consuming those type of things. And lots of sugar will increase the risk of cavities greatly. So you really want to try to stay away from those type of things. You want to try to eat as healthy as possible, you know, like natural sugars, fruits, things like that. And if you must have a Diet Coke, again, I would recommend brushing and flossing your teeth as soon as possible. So, you know, you kind of have to sit back and think, you know, if I want to have this Coke and I want to smoke and I want to eat all this candy, you're going to be brushing and flossing your teeth a lot.
Yeah,
so,
that's for sure.
So you kind of, you know, I really recommend that you cut down on the smoking and sugar. So another thing I wanted to discuss, if you're eating a lot of sugar and drinking wine and smoking, Jenna, is...
And my Diet Coke, I love it.
And your Diet Coke. You want to wait 30 minutes after you consume those things to prevent erosion. Why you want to do that is when you eat really acidic things or drink really acidic things, it softens your enamel. So you could actually damage your enamel if you brush too soon after. So you want to wait about 30 minutes before you do that. Okay?
All right, let's just hope I remember to brush after then. It's a while.
Yes. So another thing I wanted to discuss with you, Jenna, you had mentioned to me earlier that you experienced xerostomia, also known as dry mouth. Mm-hmm. I can recommend Biotine for you. It doesn't cure your dry mouth problems, but it helps, you know, try to prevent it. It comes in a form of toothpaste, rinse, spray, gel.
Like a Listerine?
Kind of like Listerine, exactly. So that can greatly improve the dry mouth.
Okay.
Okay?
Okay. Stop.
Also, if you would like to stop smoking, I'm just recommending this, just putting it out there. There's many things you can do and that you can also talk with your primary care doctor about. There's patches, there's nicotine patches, there's gum. There's a lot of measures that you can take that will aid you in at least cutting down. So I would definitely go to your primary care doctor and see what type of options him or her have to offer you. Okay. Okay? The last thing I'm going to talk about with you, Jenna, is dental caries. Like I said earlier, when you smoke, you create perio-pathogens in your plaque that make you a lot more prone to caries, also known as cavities. So this is kind of the dental caries process. It starts out on your enamel, usually on the occlusal surface, on the biting surface of your teeth, and then it goes into the dentin of your tooth structure, and that's basically the next layer in your whole tooth. This is your nerve, also known as the pulp. Once it starts infecting the nerve, once the cavity starts infecting the nerve, we really either have to do a root canal or extract the tooth, so you really don't want it to get to that point. Mm-hmm. And again, because you do smoke, you really are at a high risk for cavities.
Okay.
Okay, Jenna, do you have any questions for me?
No.
You don't have any questions? All right, Jenna. So basically, the overview of this is that you already have severe pockets. You already have 6 and 7 millimeters, like I said. You have severe bone loss. So we're going to try to do everything we can, and you need to be a part of this process too. You really need to care about your oral and dental health, to save your teeth, in other words. I'll go over brushing one last time, if I didn't make it clear before. You need to do, I showed you how to properly brush, but you need to do all of the surfaces. You need to do not just where people can see.
Okay.
You need to do the backs, you need to do the inside of the tooth, the outside, your cheeks. You need to brush your tongue and use the tongue scraper, like I said.
Should I put toothpaste on my toothbrush when I brush my tongue too?
You should not do that.
Okay.
You should not do that. That can promote something called black hairy tongue. Sounds kind of scary.
Gross.
Yes. So you don't want to do that. And you also want to floss throughout the whole entire mouth too. You really need to use the proxy brush that we talked about interdentally throughout the whole mouth. We really need to do everything we can in order to save your teeth.
Okay.
Okay?
Okay.
What else do I say?
The bio team.
Okay. I thought I already talked about it.
Yeah, you did.
But we're wrapping it up.
You're wrapping it up.
You wanted to know what you can say to
Everything,
wrap
yeah.
things
Okay.
up. So we're going to do the quick overview.
Okay. And like I had mentioned earlier, you also want to rinse with the biotene, and make that a part of your plan when you're taking care of your teeth and you're brushing your teeth twice a day, or like I said, after you smoke or anything like that. That's about it.
Okay. Well, I hope I can do this. I need my teeth.
I believe in you, and if you have any questions, don't hesitate to call the office and I can help you out.
Okay.
Okay?
Thank you.
You're welcome.